Yes, at the superiormost aspect is the apex of the lung, whereas at the inferiormost aspect, we term this surface as the base of the lung. The lung also has certain borders and surfaces. The surfaces are named based on the relations of the lung to the nearby structures. So the external surface of the lung, which is related to the ribs and the thoracic cage, the external surface is called the costal surface. This external surface of lung related to the rib cage. Whereas the term that I had used, the base of the lung, which is the inferiormost aspect of the lung, the base is related to the thoracic diaphragm. Diaphragm is the musculo-aponeurotic structure which separates the thoracic cavity from the abdominal cavity. This surface of lung is called the diaphragmatic surface or the base. Now the lung also has a medial surface. Okay. The medial surface of lung is related to the mediastinum. So I think one lecture class was taken for you. Can you type in the chat, what do you mean by the mediastinum? What is mediastinum? Anybody? At least just a general description. Yes. Very good. Okay. Yes. Mediastinum is the median septum between two pleural cavities. The lungs are present within the membranes covering it called the two pleura, and in between the two pleural cavities, in the median region of thoracic cavity, there is the area called the mediastinum. Okay, so you know the mediastinum has certain contents. The middle mediastinum contains the heart and the great vessels of the heart. Good. So because the mediastinum is present here in the midline, this medial surface of lung has two subdivisions. The medial surface largely has the mediastinal surface, whereas at the posterior most part of the medial surface of the lung, the vertebral bodies of the spine are also related. So the lungs on the medial surface also has a small area called the vertebral surface. These are the surfaces of the lung. So this is the view of lung from medial aspect. So this entire region is called medial surface, whereas this small portion close to the posterior border, this small portion is called vertebral surface, whereas the rest of the area, the large area of the medial surface is called mediastinal surface. So usually students miss that out in presentation. Okay, sometimes you think that medial surface is synonymous with mediastinal surface, but please remember that medial surface of lung is subdivided into two parts, the larger mediastinal surface and the narrow vertebral surface. Let's look at the borders of the lung. This sharp border is called the anterior border. This is the anterior border of the right lung, and this is the anterior border of the left lung. The anterior border of left lung shows a notch, which is known as the cardiac notch. That is because of the presence of the heart chambers. The apex of the heart is directed towards the left side. So the left lung has the cardiac notch. Whereas inferior to the cardiac notch, the anterior border has a tongue-like projection. This is present only in the left lung. This tongue-like projection is called the lingula. Sometimes these features are asked as a spotter question for you, especially lingula. It's a particular favorite of examiners. This area can be pinned, so you have to identify it as lingula. We will learn its functional importance in the next class. So this is the anterior border of lung. Remember that anterior border is sharp, and the anterior border separates the costal surface from the medial surface of the lung. Whereas the posterior border is blunt. The posterior border separates the costal surface from the vertebral surface of the lung. And the inferior border here, inferior border separates the base of the lung from the other surfaces. So keeping these borders and surfaces in mind, we can learn about side identification or side determination of the lung. In the exam, the most important features to identify the lung are the borders and surfaces, the parts of the lung that we had learned. Okay. First of all, you should identify the apex of the lung. The lung is conical shaped. The apex will be at the superiormost portion. It's easy to identify in the gross specimen. And the base of the lung is the broad area. The base of the lung you can use to place the lung on a horizontal plane, like the palm of your hand when you are presenting this topic. If you're getting the right lung, you have to hold it in the palm of your right hand. If it is the left lung, you have to hold it in the palm of your left hand when you're presenting for the exam. So you know how to identify superior and inferior aspect of lung. Then you look at the borders. The border that is sharp, the thin and sharp border is the anterior border, whereas the blunt border or a rounded border will be the posterior border. And in the region of the base of lung, between the base and the other surfaces will be a sharp inferior border. Now look at this surface of the lung. Okay, the external surface of the lung. Can you see some impressions there? You can see some impressions here on the external surface, or the costal surface of the lung has the rib impressions on the costal surface. So using these features, you can identify the side of the lung. Whereas on the medial surface, okay, what you saw previously with the grooves of the ribs is the costal surface. In the medial surface, the lung has an area called hilum of the lung. You can see there are so many structures entering or leaving the lung parenchyma through the region called hilum of the lung. So hilum is present on the medial surface. So using all these features, can you identify if this lung belongs to the right side or the left side? You can type it in the chat. Yes, very good. Good. This is the lung of the right side. So please keep these features in mind. There are other ways to identify whether it's right or left lung, but those features are less important as compared to all the features we discussed now. So usually if you get this topic for your discussion viva for 10 marks, this will be the first question that you're asked. What is the side of the lung and how did you identify the side? So you have to name these important features that will make a good impression, and the rest of your questions will be on the easier side if you get this much right in your introduction. Now, on medial surface of left lung, I just want you to focus on the anterior border. This is called the cardiac notch, and this tongue-like projection is the lingula. Remember that feature for the left lung. Now let's look at the fissures of the lung. Fissures are linear clefts on the lung. So you can see, okay, this is the right lung. There is a fissure which is traveling diagonally across both the right and left lung. That is called the oblique fissure. Now, can you see the right lung has one more additional fissure, which is called the horizontal fissure. Okay, so please keep in mind the right lung has two fissures, oblique fissure and horizontal fissure, whereas the left lung has only one oblique fissure. Now let's look at the lobes of the lung. Okay, the fissures will divide the lungs into different lobes. Okay, so if the right lung has a horizontal fissure and oblique fissure, the lobes are named as superior lobe, middle lobe, and inferior lobe. Whereas left lung has only superior and inferior lobe. So now you may be thinking, can you use the lobes and fissures alone as an identifying feature for the lung? Well, when you get the specimen for your gross anatomy exam, in some specimens of the lung, the pleura will still be adherent on the surface of the lung, the visceral pleura. So sometimes you may get confused as to is it the right lung or the left lung based on the presence of the fissures alone, because sometimes the pleura will be covering over these fissures. So that is why a more accurate way of determining the right and left lung would be with the borders and surfaces. Also, in some individuals, there'll be a variant anatomy where even the left lobe may have smaller accessory lobes. So all of that will lead to confusion at the time of presentation. So please just stick to the standard of explaining the borders and surfaces of the lung for side determination. Okay, so I want you all to have this in your mind that the right lung has two fissures and three lobes, whereas the left lung will have one fissure and two lobes. Get this fact straight in your memory. Now we look at the apex of the lung. Okay, we've been learning that the lungs are in the thoracic cavity. But you look at the apex of the lung is projecting into the root of the neck. Okay, apex of the lung projects 2.5 centimeters above the clavicle and is present in the root of the neck. The apex of the lung has certain important relations. We learned about the first rib. I hope you have started reading the osteology of first rib. So suppose this is the apex of the lung. You can see, if you know the relations of the first rib, you can describe the relations of apex of lung. Okay, these structures which are related to superior surface of first rib will be anterior to the lung apex. Whereas this group of structures, which is related to the neck of first rib, will be posterior relations of apex of lung. So looking at this diagram, can anyone tell me what are the anterior relations of lung apex? Yes, you can speak into the mic. Just tell me what are the anterior relations.
Subclavian artery,
Yes, good.
internal thoracic artery, and scalenus artery, anterior.
Wait, subclavian artery.
Internal thoracic artery and
Okay.
scalenus artery, anterior.
Okay, scalenus anterior. Okay, fine, good. Also mention the subclavian vein will be anterior to the subclavian artery. Okay, internal thoracic artery, even if you do not mention, it's okay. Anyway, good answer. What about the posterior relations of apex of lung? This is also another way to ask this question is relations of neck of first rib. I had mentioned it's a frequently asked question. You should name the structures from medial to lateral. So can anyone name those structures, please? You can speak into the mic, students.
Ganglionated sympathetic trunk.
Yes, first is sympathetic trunk.
And then posterior intercostal vein. First posterior intercostal vein.
Yes, it's also called the highest intercostal vein. Okay, good.
Superior intercostal artery.
Yes. And then finally, there's one more nerve over there.
Brachial plexus. Lower trunk of brachial plexus.
Yes. Okay, good. This position here, okay, this one, we should just name it as the T1 spinal nerve, which will then form lower trunk of brachial plexus going above the first rib. Okay, good enough, students. The diagram is there to help you. Anyway, I'm happy that you spoke up and told these answers. So this is quite simple if you know this diagram. So the relations that are in front of the neck of first rib, if you remember from last class, we had said that the acronym is sitting in the van. Okay, that is S for sympathetic trunk, then van for vein, artery, and nerve. Okay, so in thorax, if you learn one topic well, it will help you to correlate with the other topics. So now in this diagram, we can see the lateral relationship of apex of lung is the muscle called scalenus medius. Whereas medially to the lung apex, there are certain relations which is slightly different for the right lung and the left lung. Now, if you have started reading the topic of mediastinum, it will be easier for you to learn these structures. Okay, I think class was taken, yes, for mediastinum?
Yes, ma'am.
Yes,
ma'am.
Yes, yes, so make sure that you revise that. What are the contents of anterior mediastinum, middle mediastinum, and posterior mediastinum? Because that will help you to remember the medial relations of apex of lung. So I'll just list it for you now. You can revise it later. For the right lung, anteriorly, there is the right brachiocephalic vein, the right phrenic nerve, and the brachiocephalic trunk. Whereas for the left lung, there is the left brachiocephalic vein, the left subclavian artery, the left phrenic nerve. Now for the left lung, you have to mention two more additional structures which are present in the posterior mediastinum. That is left recurrent laryngeal nerve and thoracic duct. Okay, so all these terms may seem like Greek and Latin to some of you, but don't let it discourage you from learning about thorax. If you just spend a little time in reading and revision, you will be hearing these names again and again throughout the discussion of thorax. So just start studying it now itself. So those were the relations of the lung apex. So I told you that the apex of the lung is present at the root of your neck. And we saw in the diagram that apex of lung is present 2.5 centimeters above the clavity. Yet when you take a deep breath on inspiration, you do not see the apex of the lung, on your body and you do not feel any expansion at the root of your neck. So why is that so? Okay. Anyone has an answer? The apex of the lung. Why do we not feel it like a balloon at the root of our neck during inspiration, even though it's present in that region? Does anyone have any theories anatomically? Why is it so?
Because of the presence of Simpson's fascia.
Yes, very good. Okay, I've seen some other answers. Okay, good, good. You can see in this diagram, see, this is the apex of lung. It is actually covered with a membrane, which is called Simpson's fascia or the suprapleural membrane. Suprapleural membrane is attached to the inner margin of the first rib. So it is said that according to evolution, the Simpson's fascia developed from a muscle called scalenus minimus muscle. That is why it is not only a membrane, it is similar to an aponeurosis because it is developed from a flattened muscle called scalenus minimus. That gives it its tough, rigid structure. And the function is that it gives support to the apex of the lung and it prevents the neck, the root of neck, from being ballooned out during inspiration. So aren't you grateful that human beings have the Simpson's fascia? Yes, otherwise during inspiration, we'd all look something like this, like the vocal sac ballooning out. Even that would happen to humans. Wouldn't that be a sight to see? Okay, so that's why you can all be grateful to the subject of anatomy for the way that our body is created with a perfect function in mind. Okay. Now, the clinical anatomy of the apex of the lung. If there is a tumor at the apex, it is called Pancoast tumor. It will have certain clinical features. Can anyone mention one clinical feature if there is a tumor at apex of lung and it compresses nearby structures? We learned so many structures here. Can anyone tell me one structure which is compressed and what is the clinical feature that you will see in tumor of apex of lung? Anyone?
The ventral ramus of T1
Yes,
gets compressed.
yes. So what will be the clinical feature then, Nitin? Any idea?
Pain along the forearm.
Yes. Which aspect of forearm? If it's T1, with your knowledge in brachial plexus?
Yeah.
Okay.
Medial.
Yes, very good. Good. The T1 dermatome is along the medial aspect of the forearm. So the pain will be along the medial aspect. Very good. What about if the sympathetic chain is compressed? There will be a condition that is produced called Horner's syndrome. So since I've been teaching you upper limb, I think I've been mentioning Horner's syndrome. It's a very important clinical feature to help you determine the site of lesion for certain diseases. So does anyone know what are the clinical features of Horner's syndrome? You can type it in the chat. What are the features of Horner's syndrome? What are the points? What are the clinical features? Either you can, ptosis. Ptosis means drooping of eyelid. Very good. Any other feature? Anhidrosis. Anhidrosis means loss of sweating, and that will happen on the affected side. So there'll be loss of sweating on the, say, half of the face. Miosis. Miosis means pinpoint pupil or constriction of the pupil, and another feature called enophthalmos. Enophthalmos means the size of the eye will get shrunken. Okay, so yes, I am happy that you know the features, some of you, but all of you, please learn it. By now, you should know what are the features of Horner's syndrome. Ptosis, meiosis, enophthalmos, and anhidrosis of half of the face. There is an area in which structures enter the lung and certain structures leave the lung parenchyma. This is called the hilum of the lung. Another word for hilum is a gateway. Now we need to learn what are the structures which are present at the hilum. This is also a favorite question for your exam. These structures have great clinical importance as well. So this is the diagram that you have to learn from your textbook. Okay, for all of you need to know, it's a must-know topic. What are the structures present at the hilum of the lung? So when you take one look at the diagram, it's very easy to get intimidated because there are a lot of arteries, veins, and there are also bronchi. And these structures are slightly different also for the right lung and the left lung. So how to remember these structures? You can use an acronym. It's given in your textbooks as well. First, we will learn about the left lung. Okay, so do you remember the left lung has how many fissures and how many lobes? You can type it in the chat. How many fissures and how many lobes are present in the left lung? Yes, one fissure and two lobes. Good. So that's why we're starting with the left lung first, because it has only two lobes as compared to the right lung. The left lung, the number of structures in the hilum also will be slightly less, because the two lobes will have one main bronchus entering into the hilum. So let's look at the structures. Okay, for learning the structures, you have to remember in order from superior to inferior. Okay, yes, all of you, please mute your microphone, please. So from superior to inferior, the structures are A, B, and V. A for artery, B for bronchus, and V for vein. Now the artery is pulmonary artery and the vein is pulmonary vein for this acronym. So for left lung, the sentence you can use as an acronym is actually a question, as are boys vegetarians? Okay, I know that most of us are kind of carnivorous, especially in the adolescent stage when we need to eat a lot. Okay, so but the code that we use is, okay, it's a question that the left lung asks. Okay, are boys vegetarians? Or there's another code in your textbook which is given, are beasts violent? Okay, just whatever is aiding your memory, you can just learn that from superior to inferior, the code is A, B, and V. So let's look at the structures at the hilum. The superior most structure in the left lung's hilum is pulmonary artery. Next, the structure B is the bronchus. Whereas the inferior most structure, there are two smaller structures, which is the pulmonary vein. Okay, V for vein. So it's artery, bronchus, and vein. Then randomly placed are bronchial arteries. Even if you don't mention it as the main structures at the hilum, it is okay. It is a minor structure. So that is why we're not including it in the acronym. So please remember A, B, V for the left lung. What about for the right lung? Now the right lung has three lobes, and before the main bronchus enters into the right lung, it will divide into two subdivisions. The right bronchus divides early before it enters into the hilum of the lung. So if you look at this diagram, you can see there are two bronchi in the right hilum. Okay, so if this is a pulmonary artery, above the pulmonary artery, the name of the bronchus is eparterial bronchus. If you know the anatomical term, epi means superior to and hypo means inferior to. So the bronchus, which is above or superior to the pulmonary artery, is called eparterial bronchus, and the bronchus, which is inferior to pulmonary artery, is called hyparterial bronchus. So how to remember this as an acronym? Okay, remember left lung was the question, are boys vegetarians? Whereas the right lung says the answer, which is boys are born vegetarians. Okay, BABV. So B is for eparterial bronchus, A for pulmonary artery, the next B for hyparterial bronchus, and finally for pulmonary veins. So make sure you revise this. It's extremely important for each of you to know what are the structures at hilum of right and left lung. You can use any acronym or memory aid you want, but please learn these structures from superior to inferior. These structures will also help you to score a little more in your exam. Okay, if you get these basic points right, it'll give you a sense of peace and calm mind in the exam. Those are the structures at the hilum of lung. So hilum, I had told you, is present on medial surface of the lung. Whereas there is another terminology called root of the lung. Root of the lung is what I have labeled with this arrow. Root of the lung are the structures which connect the lung with the mediastinum. Okay, this will be a little more evident if you see the dissection video we'll be sending you this week. Okay, there are certain structures. Okay, all the structures that I told you at hilum. That is the pulmonary artery, the pulmonary vein, the bronchi. They're all structures from the mediastinum which enter into the lung or structures which leave the lung. So there is a connecting area between the hilum and mediastinum. So that area which connects the lung and mediastinum is called root of lung, and it is covered with a tubular sleeve of pleura. So we can compare, suppose the hilum or the gateway you compare to the doorway of a room. The root of lung you can compare with a corridor or a passage leading to that door. Okay, so the hilum is like a doorway or a gate. The root of lung you can compare with the corridor that leads to that door. Okay. It is just a matter of interest. Sometimes you will be asked, what is the difference between hilum and the root? So just know hilum is this area on the medial surface of lung, whereas a tubular sheath, okay, so imagine if this tubular sheath is prolonged into the mediastinum with certain contents, what connects the lung to the mediastinum is called root of lung. Now, one more structure you need to know here is pulmonary ligament. Pulmonary ligament is a double fold of mediastinal pleura, which will be present at the inferior aspect of hilum of lung. Okay, pulmonary ligament, double fold of mediastinal pleura, present at the inferior aspect of hilum of lung. So this is a frequently asked spotter question. The function of pulmonary ligament is just that it provides a potential space for expansion of pulmonary veins. Please learn the features of pulmonary ligament. There's just 1 or 2 sentences in your textbook, but learn it thoroughly. Keep the term pulmonary ligament as an important fact in your mind. We are going to just start looking at what is the anatomical position or what is the anatomical orientation of the heart? We need to know that because, see, look in this picture. This is the medial surface of the right and left lung. So whatever is present in the middle mediastinum, which is the heart and the great vessels, these structures will form certain impressions on the right and left lung. So if you want to learn the relations of right lung and left lung, we first need to look at what are the structures in the mediastinum. Okay. So let's just take a small revision of what you had learned in your biology classes. Okay. Remember that you had learned the deoxygenated blood will reach the heart through the superior and inferior vena cava. Then the blood goes into the right atrium, the right ventricle, and to the pulmonary artery. Then you know that the oxygenated blood through pulmonary vein enters the left atrium, the left ventricle, and then to the aorta. Yes, this is how you had learned it in your school, right? This is the diagram that you had learned. But today, I just want to show you the anatomical position of the heart. Yes, so look here. The right border of the heart is formed by the chamber right atrium. Mainly, the right atrium is oriented this way towards the right border of heart. Then the veins opening into the right atrium is superior vena cava and inferior vena cava. Whereas look at the left border. Okay, so based on this diagram, can you just tell me left border of heart is formed by which chambers? Yes, it's given in the diagram. I told you right atrium is present on right border. Yes, for left border, it is what?
Left atrium.
Yes. Is it only left atrium or one more chamber is there? Malavika. Look here, left atrium, and here is left ventricle also. Good. So there's left atrium and the major portion is by left ventricle. So please get this idea in your mind. This is the anatomical orientation of the heart. Whereas this portion over here, okay, see, this is the left ventricle. This chamber is right ventricle. And remember from the previous diagram, we learned that the right ventricle goes into the pulmonary artery. So here, from right ventricle, here comes pulmonary trunk. So there is a small portion here, a small portion of right ventricle, which is known as infundibulum of right ventricle. Okay, I'm just telling you these features now. Please revise them and I'll be sending you the notes. So I'm telling you all this so that we can learn the relations of right and left lung. Okay, today we'll deal with the right lung. The left lung we'll deal with at another time. So let's look at the right border of heart. Okay, so just look here and you tell me the right border, does it have veins or arteries on the right border of heart? Yes.
Veins.
Tighten. Yes, it's veins. You can see it clearly. The right border has the veins mainly, whereas on the left, towards the left aspect, if you imagine the left lung here, you can see there is the aorta and its branches. So towards the left will be the arteries and towards the right are the veins. That's very important for us to learn the relations of the lungs. So first we're dealing with the right lung. So right lung, you all know one important relation is superior vena cava, then the chamber of the heart, right atrium, and below will come inferior vena cava. There's one more vein which you have learned in posterior mediastinum. It is called azygous vein. Okay, you would have heard this term in posterior mediastinum, azygous vein. What is the meaning of the word azygous? Anyone knows? In genetics, you would have learned about homozygous, heterozygous. Now we are learning a term called azygous. What is the meaning of the term azygous? Anyone knows? Okay, you can just check it up. Yes, azygous means unpaired. It's a single vein. Okay, this vein has no corresponding vein to pair with it in the body. There's only a single azygous vein in the body. Okay, so azygous vein is present at the right side of the posterior thoracic wall. So you can look at the course of azygous vein. It will form an arch like this, and finally it drains into superior vena cava. Okay, so azygous vein in posterior mediastinum forms an arch and enters into superior vena cava. Now finally, two more structures in posterior mediastinum are the windpipe and the food pipe that you know, the trachea and the esophagus. The trachea comes anteriorly and the esophagus comes posteriorly. So I'm telling you all these relations because just like these structures are present in the mediastinum, in the same order, there will be an imprint on the right lung. Just like if you take a piece of clay and you imprint a pattern on it with a mold, the same pattern will appear on the clay. So in the same way, these structures in the mediastinum, they're closely related to the soft lung tissue. So they'll produce certain indentations and grooves on the right lung. So let's look at the relations of right lung. Before going to that, I just want to say one more small point. Okay, these are the veins of posterior mediastinum. I just want you to focus on superior vena cava here. Okay, superior vena cava, it also receives a vein called the right brachiocephalic vein. I just want you to keep that in mind. Right brachiocephalic vein also enters into superior vena cava on the right side. This is the dissection specimen to show you a azygous vein in the right side of the mediastinal wall, the posterior mediastinum. This is arch of azygous vein, and this is superior vena cava. Okay, so using all this information, you can learn this diagram. So this is another frequently asked question for dissection, for theory, favorite question, can also be a diagram question for you, just like brachial plexus was also a favorite question for theory and diagram. So this is the last topic I am taking today. Okay, after that, you can just relax. We will continue with this class on Saturday evening. Okay, so today evening, I would like you all to draw this diagram. You can learn it and draw it. And those who are interested to have it corrected by me, you can send it to me through WhatsApp. Okay, either today or before Saturday's evening class, you can do that if you have time. Okay, anyway, learn this diagram. So this is the medial surface of the right lung. So remember, right side, we are drawing or we're learning only about the veins. The veins are what is prominent on the right side. So if you imagine the heart in this position, here is a groove for superior vena cava, and inferiorly, there will be a groove for inferior vena cava. Okay, so superior vena cava is related here, and inferior vena cava inferiorly. Then we learned that arch of azygous vein enters into superior vena cava. So arch of azygous vein is related superior to the hilum of lung, And here is a groove for right brachiocephalic vein. Okay, so these are all the veins emptying into superior vena cava. Right brachiocephalic vein, arch of azygous vein. So if you imagine the heart is present here, which chamber of heart forms the right border? You can type it in the chat. Which chamber of heart forms right border of heart? It's the right atrium. Hope everyone is following. Right atrium. Yes, so this groove or this area is impression for right atrium of the heart. And finally, yes, good class. I'm glad you are answering. Finally, here, posteriorly, there will be two longitudinal grooves. That is the area for trachea and esophagus. Okay, area for trachea will be anterior, and area for esophagus is this long area that will be passing from apex to posterior to the hilum. Now, when you are drawing the medial surface of right lung, you also have to draw the structures within the hilum in order.